What if sitting inside a pressurized chamber and breathing pure oxygen could influence how your body ages at the cellular level? A team at Tel Aviv University published a study suggesting exactly that, and the numbers got the scientific community's attention. Before we get into the research, a quick note: nothing in this video is medical advice. If any of this sounds relevant to you, talk to your doctor. HBOT is a medical treatment, and it should be treated like one. So here's how hyperbaric oxygen therapy works. You're placed inside a chamber pressurized to 1.5 to 3 times normal atmospheric pressure, breathing 100% pure oxygen. At that pressure, your lungs absorb significantly more oxygen than they normally would. But here's the interesting part: that oxygen dissolves directly into your blood plasma, which means it doesn't rely solely on hemoglobin for delivery. It can reach tissues that compromised blood vessels may struggle to supply. Research suggests the body responds to this oxygen environment in several ways. Studies have observed new blood vessel formation, reductions in inflammatory markers like TNF-alpha and IL-6, increased mitochondrial activity, and mobilization of stem cells from bone marrow. It's not introducing a foreign substance, it's changing the conditions under which your own biology operates, which brings us to that Tel Aviv study. Published in the peer-reviewed journal Aging in 2020, Professor Efrati and Dr. Efrati Hadanny enrolled 35 healthy adults over 64, not patients with a disease, and put them through 60 daily hyperbaric sessions over 90 days. No changes to diet or exercise. B-cell telomeres lengthened by roughly 37%, and senescent T helper cells, sometimes called zombie cells because they stop functioning but don't die, decreased by over 37%. Now a few things worth noting. This was a small study, 35 participants, and telomere length is one biomarker of aging, not a complete picture. The researchers themselves have called for larger follow-up trials, but the results were striking enough to generate serious academic interest in whether HBOT could play a role in age-related cellular decline. Aging isn't the only area where HBOT shows up in the research. Diabetic foot ulcers are notoriously difficult to treat. They resist healing, they get infected, and they frequently lead to amputation. A meta-analysis of multiple randomized controlled trials found that patients receiving HBOT had significantly better outcomes, roughly 52% healed at 1 year compared to 29% in control groups. Amputation risk was reduced by approximately 40%. One individual trial reported a 78% healing rate in the treatment group versus 0% in the control group, though results varied across studies. For anyone facing the possibility of losing a limb, that kind of data is worth paying attention to. Then there's the neurological research, which is where things get particularly interesting. Joe Namath, the Hall of Fame quarterback, underwent 120 sessions of HBOT after brain scans showed what his doctors described as significant traumatic brain injury from decades of football. His follow-up imaging showed meaningful improvement, and the experience led him to found the Joe Namath Neurological Research Center. It's important to say clearly that's a single case, not a clinical trial, but it's one of many anecdotal accounts that have helped build momentum for formal research. That formal research is now underway. The University of South Florida is conducting a $28 million, 5-year double-blind randomized study on over 400 veterans with TBI and PTSD. It's the largest HBOT study for brain injury ever undertaken, and the fact that it secured that level of funding suggests the scientific community sees enough preliminary evidence to justify rigorous investigation. There's also a completed double-blind randomized trial looking at HBOT for long COVID, 73 patients, 40 sessions. The researchers reported improvements in cognitive function, attention, and executive function, with a pain severity effect size of 0.69, which is considered clinically meaningful. Perhaps most notably, benefits appeared to persist a full year after the final session. For people who have struggled to find effective treatment for long COVID, those are encouraging results, though larger trials will be needed to confirm them. A few practical details. The FDA has cleared HBOT for 14 specific conditions. Sessions typically range from $150 to $600, with an average around $400. One important distinction: the soft, mild chambers available for home use generally operate at about 1.3 atmospheres with ambient air, not 100% oxygen. That's a fundamentally different intervention from the clinical protocols used in research, which typically involve 2 to 3 atmospheres with pure oxygen. It's worth understanding that difference before drawing conclusions about what the research does and doesn't support. The body has a remarkable capacity for repair when given the right conditions. HBOT appears to tap into some of those mechanisms in ways we're still working to fully understand. The research is promising and it's still evolving. If this is something you're considering, bring the studies to your doctor and have the conversation. This video is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before starting any new therapy.